Hi, and welcome to the Paxton Packing team. My name is Melanie Kyle, and I'm the Quality Assurance Manager at Paxton, where we're striving to become one of the foremost craft jerky and snack food producers in the U.S. We've been working really hard to expand our capabilities in Paxton and our Danville locations, and we're really excited to have some awesome people joining us who want to be part of that success. We're really glad you're here. One of the most important parts of my job and your job is food safety training. This is the first in a series of videos that will walk you through the food safety guidelines, practices, and procedures at Paxton Packing. As a food manufacturer, food safety is our business. The quality and safety of our products is our top priority. And good manufacturing practices are how we ensure the safety of the food we produce. Good manufacturing practices, or GMPs, describe the conditions and practices that are necessary for the safe manufacturing, processing, packing, and storage of food. Good manufacturing practices include guidelines and procedures for personnel, including health and hygiene, sanitary operations, buildings and facilities, equipment and utensils, production and process controls, warehousing and distribution. This video series will focus on personnel, health and hygiene, and sanitary operations, the GMPs that you will be most involved with. Following these GMPs is required by the FDA and USDA. One of the most critical GMPs at Paxton Packing is our employee health and hygiene policies. The purpose of these policies is to prevent food employees from contaminating food by spreading viruses, bacteria, or potentially physical contamination to the food. The policies require that employees notify their manager if they're experiencing any of the symptoms or conditions that could lead to the transmission of foodborne illnesses or communicable diseases. During this global COVID-19 pandemic, our employee health policy has been updated to reflect our commitment to providing you a safe and reliable workplace. Guided by respected infection prevention experts at our local health departments and recommendations from the Centers for Disease Control, we have taken a number of steps in addition to our standard sanitation control measures to ensure our facilities remain safe places to work. We are restricting all visitors and allowing only critical and repair supply contractors on site. We are encouraging all employees that can work from home to do so. Reducing the amount of people in our facilities helps reduce the risk of exposure. We are requiring all employees to wear masks. Masks will be provided, if you don't have your own, at the entrances to the facilities. Employees must wear masks at all times except when eating or drinking. All critical visitors must wear masks while in our facilities. Hand sanitizer is available at each entrance and at numerous locations throughout each building. Everyone is asked to sanitize their hands when they enter the building and before and after clocking out. All employees are asked to self-monitor for symptoms and take their temperature in the morning before they come into work. Employees are required to fill out a symptom log when they get to work. We're ramping up our cleaning procedures and ensuring that areas such as break rooms, lobbies, restrooms are cleaned often with COVID-related disinfectants, with special attention to frequently touched surfaces, including doorknobs, armrests, and handrails. We know these restrictions can be challenging, and we thank you for your understanding and commitment to employee health and safety. COVID-19 spreads easily. If you're experiencing any of these symptoms, fever, cough, difficulty breathing, chills, repeated shaking with chills, muscle pain, headache, sore throat, new loss of taste or smell, stay home, inform your manager, and call your doctor or the health department. Also, if you have been a close contact to a COVID-19 case, you must self-quarantine at home for 14 days from the last date of exposure to that case. COVID-19, however, isn't the only transmissible disease that we worry about in the food industry. We're also worried about those conditions that could cause foodborne illnesses. And that's why it's really important to stop and stay home if you're sick. If you're experiencing diarrhea, vomiting, jaundice, fever, or sore throat with a fever, you might be infected with something that could cause a foodborne illness. It's important for you to stay home and inform your manager of these symptoms. You must wait 24 hours after the last symptoms of diarrhea or vomiting have passed before you can return to work. Food employees must also notify their manager whenever diagnosed by a healthcare provider with any of the following diseases: hepatitis A, E. coli, norovirus, salmonella, or shigella. These are infections that are easily transmitted through food and can cause foodborne illness. They can also be transmitted through direct person-to-person contact quite easily as well. If you've been diagnosed with any of these infections, hepatitis A, E. coli, norovirus, salmonella, or shigella, you must have a doctor's note to return to work. Our employee health policy also covers cuts, lesions, and skin conditions. Food handlers with exposed cuts, sores, or lesions, or infections are not permitted to handle food unless they can be covered with a suitable protective covering. This means a waterproof bandage. These coverings must be monitored regularly by responsible personnel to ensure they remain intact and effective. Bandages on hands and fingers are required to be covered with a suitable glove, and by this we mean a single-service disposable glove. Let your manager know if you have a cut or an infection or a skin condition, or you happen to get cut at work. Thank you for your attention. Please complete the quiz linked below before moving on to the next video.